Amar here from GoggleDocs, and here to talk to you specifically about youth-onset type 2 diabetes. Now, why is this important? Well, we know about 120,000 people in the UK living with youth-onset type 2 diabetes, which is defined as type 2 diabetes in those less than 40 years old. Why is that important? Well, just look across the pond at the USA. There's data from the Search and Today studies looking at people with type 2 diabetes in youth and following them up for a period of time. And what we found from that is that people with youth-onset type T2D basically have higher risk of microvascular and macrovascular complications, and those of childbearing age, if they do become pregnant, are at higher risk of complications during pregnancy, both for the mother and the child. So it becomes even more important from a public health perspective, but also from a clinical perspective, to look at this group almost as a separate entity of those with type 2 diabetes, to really focus on management, to try and identify those at higher risk, but also intensively manage them. Now, how do we do that? Well, there's no specific treatment management, really. There's, all the medications that we have for type 2 diabetes are all, ready to go for people with youth-onset type 2 diabetes. The only difference is that we've got to be aware that people of childbearing age, we've got to consider what medications we use. And perhaps the medications that are, taken a lot of interest recently with SGLT2 inhibitors and GLP-1, perhaps those may be ones more useful because, again, they help lower weight, which, again, is quite a key consideration in this group, because those at risk are those with obesity, those with high BMIs, with ethnic minorities. Again, we see similar trends to those who are at high risk of type 2 diabetes, again at high risk of youth onset in that. Now, one thing to be aware of is about the importance of misclassification. Whilst you might consider that youth onset type 2 diabetes as having type 2, they may have type 1, might have genetic diabetes, or vice versa. So it boils back to, again, education and identifying those at those who you may think may not quite have standard type 2 diabetes, and consider what other tests you might want to do, be it C-peptide, be it genetic testing. On top of that, also, it's about prevention. So it's not just about identifying those who do have type 2 diabetes, it's about preventing those who are at risk of type 2 diabetes, especially in the subgroups who are at higher risk, and to prevent that development of type 2 diabetes at the earlier onset. What's really highlighted this has been recent data. We've known from the past as well, people with youth-onset type 2 diabetes have about a 6 to 7 year reduction in life expectancy compared to those who don't. However, more recently, there was a paper looking at following people with type 2 diabetes across the age of diagnosis, and it found that for every 10 years early you're diagnosed with type 2 diabetes, your life expectancy reduces by 3 to 4 years. Again, another reason, yet another reason why we should really look at this population. In terms of the UK, what's being done? Well, there's been initiatives from the NHS England, called the T2DAY program, which is identified and providing funds to ICBs to really target this group to see how best we can manage them. But what's most important really is the identification and management and education, really, both especially in primary care, because that's where a lot of this will be done. And I think that's where, yes, secondary care, but also primary care, and where we really need to focus in terms of risk stratification, understanding, and managing our patients with youth-onset type 2 diabetes.